Hello, good day, dear students. Today we are going to study and discuss a disease which is a zoonotic disease. As you can see in the title of the PowerPoint presentation, you can see a rabid dog biting to a man. So, a disease which is transmitted by the bites of animals, that is called zoonotic disease. That is a disease which is transmitted through animals. We call that as a zoonotic disease. Zoo, basically you must be knowing, zoo is a word which stands for animal. So, we are going to discuss a disease related to the one which is transmitted by animals, and that is rabies. Okay, so let us learn about this disease in detail. Rabies, this particular disease has been recognized in India since long back, since the Vedic period, that is more than 2500 to 4000 years before. In 1500 to 500 BC, before Christ, this disease was described and can be seen in Indian scriptures. It has also been mentioned in Atharva Veda. And it is an endemic disease in India, where a vast country with a very large population, you will always find few cases reported from some points. That is what we call it as an endemic. In contrast to pandemic, where the disease is widespread over a large area, large part of the world, endemic disease is the one which occurs at a regular interval in various parts, that is known as endemic disease. The diagram which is showing here, the map which is showing here, the disease you can see is very much prevalent in India, where there are more than 10,000 deaths on an average per year, while it is also prevalent in certain other countries, Southeast countries, as well as in China, Pakistan and Iran. This disease is also widely spread in Africa as well as Asia, and all over the world, more than 55,000 people die of rabies every year, out of which about 95% of the human deaths occur in Asia and Africa. Most of the human death, they follow a bite from infected dog. About 30 to 60% of the victims of the dog bites, they are below the children of the age 15. Now, this is a zoonotic disease which is caused by a virus, a rhabdovirus. Rabies basically infects domestic as well as wild animals and is spread to the people through very close contact with infected saliva of the diseased animal. It can also be transmitted when your scratches or the bites are infected with the saliva of an infected animal. This disease is nearly present in each and every continent, but the most common deaths occur in Asia and Africa. Once the symptoms of this disease begins to appear, the disease is fatal. That is, leads to the death of a human being. Now, what are some of the very common facts? The first one is the mad dog, or a rabid dog, I would say. It bites humans, which leads to rabies. In Latin, the word basically rabies is derived from a Latin word in which rabhas means frenzy. The individual as well as the animal fears of water, hydrophobia. Hydro means water, phobia means afraid of water. So there is a fear of water, and the saliva of rabid dog contains these viruses. It was, if you remember, the Louis Pasteur who developed the vaccination against rabies by using the dry powder of the bones obtained from dead animals. It is basically the vaccination which was one of the earliest vaccine developed after the Jenner's vaccination of smallpox. Here it is a vaccination due to the fixed virus from rabbit which is injected into the human persons, infected persons. One of the first person who was injected or given a vaccination was Joseph Meister, and he was injected with 13 injections of the cord vaccine. Now, as I have told you, it is a zoonotic disease caused by a virus belonging to Rhabdovirus family, and the genus is Lassa virus. It is basically, as we will see the structure in the following slide, an enveloped bullet-shaped virus. The disease is a slow, progressive zoonotic disease, and the primary reservoirs of this disease are wild mammals. It can be spread by both wild as well as domestic mammals by bites, scratches, and inhalation of droplets. So this is basically a diagram which shows a dog which is diagrammatically showing how does this disease progress. It is because of the bite of one another mammal, maybe a dog or fox or even a cat. When it bites to another mammal, when they fight with another, then they bite each other, then this virus spreads through nervous system. That is, it replicates in the muscles, and through the nervous system, it reaches the central nervous system, that is the spinal cord, from where it travels to the brain, and here the infection spreads. From here, then the virus also spreads to the entire body, and through saliva this virus may come out. So this is, as I told you, the bullet-shaped virus. It is an enveloped virus, and it contains a genome which is a single-strand RNA virus. It belongs to our Lassa genus. Lassa means rage. Rage means fear. So the size of this virus is around 180 to 75 nanometer, and the outer layer, this green colored one, is a lipoprotein which is containing spikes which are made up from glycoprotein S. The RNA which is present inside this is basically a genome which is unsegmented, means it is a continuous RNA strand. And the linear negative sense RNA is the one which would take into multiplication. Now, there are two words which are very important, you should understand. First is the fixed virus and the second one is street virus. Now, what is a fixed virus? Fixed virus is a one whose virulence and the incubation period, they have been stabilized by the serial passage from one animal to the another animal, or from one culture to the another culture. That I am talking about the tissue culture, it's a virus. So the virulence as well as the incubation period have been stabilized. Stabilized means it has been attenuated through the serial transfer from one culture or from one tissue culture to another, from one animal to the another, and it remains fixed during further transmission. Now, this rabies virus, which has undergone a serial passage through rabbits, is thus stabilized in its virulence power and in its incubation and is known as fixed virus. This is in contrast to the street virus, which is from a naturally infected animal. This is in total opposite to the viruses which are grown in laboratory from one animal to the next animal. These are basically, street viruses are from naturally infected animals in a population, and the strain does not get fixed. That is, it does not achieve attenuation. This is a virulent strain, and this virulent rabies virus, when it bites the another animal in its natural environment, the bitten animal will contract a disease from the infected one, either through bite or through the scratch, and this is known as a street virus. So, street viruses are virulent strains, while the fixed viruses are avirulent strain, and the vaccine is normally made from fixed viruses. Of different or many mammals, one can say that any mammal can get rabies. That is, any mammal can get this disease. Examples are raccoons, skunks, foxes, and even bats. Dogs, cats, cattle, and ferrets are also among the animals. And in case of other individuals, human being is the one who can be infected. Mammals are normally warm-blooded animals which have hair and mammary gland to produce milk for their babies. Animals like frogs, birds, and snakes, they do not get rabies because they are not included in a mammal. Now, this is a caution which is shown by a one line. Man's best friend, that is, here it is a diagram or a photograph of a girl who is playing with a dog. So, dogs basically, to convey the meaning, dogs are basically man's best friend, but they can spread the rabies if these animals are not vaccinated. So, remember, the domestic pets, they have to be vaccinated against the rabies disease. These viruses, they are sensitive to certain common chemicals. For example, it is sensitive to ethanol, iodine, soap and detergents. Why this particular word has been highlighted? Because whenever a human being, a person is bitten by an animal, the first thing that anyone has to do is to clean that wound with soap and detergent very thoroughly, so that the viral load is reduced as much as possible. Because viruses are sensitive to soap and detergents, the spread can be minimized. The load can be minimized. Apart from this, the virus is also destroyed by chemicals like ether, chloroform, and acetone. Remember, this virus can be destroyed when heated at 50 degrees centigrade for about 1 hour or at 60 degrees centigrade in 5 minutes. Why this is important? Because these properties can be used for control against this disease. Now coming to the antigenic property of this virus, these viruses have surface spikes, that is, these are called spikes, or hair-like projections, or I would say needle-like projections. These spike proteins, they are very much similar, you can say, to the spike proteins of COVID virus. So these surface spikes, they are composed of glycoprotein G, and it produces a pathogenicity by binding to acetylcholine receptors in neural tissues. That is, it binds to the neural tissues, that is to the nerve cells, and it stimulates T lymphocyte cytotoxic effects. Now, how the transmission of this disease takes place? This disease can be transmitted by abrasions or scratches on the skin, which may be infected by saliva of an animal. Probably even a domestic animals, when it plays with you or when it makes love to you, it would I would say leak the skins. It's a very common property of any domestic animals that it would leak your body parts. So during this leaking, the scratches or abrasions on the skin, that is the open skin, wounds, etc., through this the virus may enter. The mucous membranes which are exposed to saliva can be dangerous, and most frequently via deep penetrating bite wounds. When superficial leakage of the wounds or abrasions are done by infected animals, the virus can be transmitted, but the more possibility is when the wounds are due to biting of an animal, at that time when the biting is basically a deep penetration of the soft skin tissues. Then this infected saliva can reach very rapidly to the nerve cells, where virus get attached to the acetylcholine receptors on nerve cells. Apart from this, the other routes include inhalation, that is, inhalation of infected droplets. So inhalation in bat, which is there, bats normally hanging in caves. So through their droppings or through their infected air or ingestion of dead or infected animal meat, or even corneal transplantation has been found to be able to transmit this virus disease. Now, how does it spread? This is the diagram which explains you the spread of rabies virus. Whenever the animal bites, the farther away from the brain, the longer virus takes for the spread. For example, this is the main site, that is the brain. If the animal bites to the leg of an individual, the distance from leg to the brain is very far as compared to the bite from the hands or from your trunk. So, this distance, when the biting is here in the arm or here or even in the leg here below the belt, then depending upon the distance from the brain, the speed of infection will slow down. So virus spreads through central nervous system, that is this. Okay. Common carriers are bats, fox, cats and skunks. The symptoms, as we will see, but just to tell you in brief, includes fever, depression, agitation, painful spasms, followed by excessive salivation, and the death occurs normally if not treated within a week without vaccine. Now coming to the pathogenesis of a rabies, then first thing is bite by a rabid dog or other animals would transmit, or the virus would transmit through the bite of these rabid dog or animals which carries these viruses in saliva. They are deposited on the wound site. If untreated, 50% will develop rabies. Rabies can be produced not only by bites but can be produced by leaks and even by corneal transplantation, as mentioned earlier. The virus multiplies in the muscles, in the connective tissue and nerves after about 48 to 72 hours. And finally, it penetrates the nerve endings. So, live viruses from epidermis, mucous membranes, it is coming to peripheral nerve, which is passing on centripetally to central nervous system, that is the gray matter, and finally leading to brain. From that, centrifugally, it will be distributed to other body tissues, including salivary glands. So, here the brain is inflamed as it is shown here. This is the typical photograph which was taken due to the bite of a rabid dog. You can see various teeth penetrating into the forearm of an individual. Now, if you see here, the virus enters animal via a rabbit bite. For example, the animal, that is the dog, bites here. Then the virus replicates in the muscles at the site of bite. Here virus will indicate. In the third step, virus infects the nerve endings in the peripheral nervous system, means these are the peripheral nervous systems here, and moves by retrograde transport. Fourth step is the virus replicates in the dorsal root ganglion and travels up the spinal cord through the brain like this. when the brain is then infected. And then once the brain is infected, virus travels from brain via nerves to other tissues such as eyes, kidneys, and salivary glands here. So this is how the virus will be transmitted in our body. It will travel in the body. From brain, virus spreads to salivary glands, conjunctival cells released into tears, that is to the eyes also, in the kidneys, in the lactating glands, that is through milk after pregnancy or including in the pregnant woman. Rabies virus may infect the central nervous system as here. This is the brain and this is the spinal cord. Virus travels through exoplasm towards the spinal cord at the rate of 3 millimeters per hour. The spread from brain centrifugally to various parts of the body means it disseminates from brain to different parts of the body. It multiplies in salivary glands and it is shed in saliva. Corneal, that is the eyes, facial tissues such as skin and other things, they are also infected. Incubation is normally ranging from 1 to 3 months, but on an average it takes between 7 to 3 years also. Earliest it will be 7 days, or in some cases it may take a very long time, that is up to 3 years. There are 3 stages of the disease. First one is prodrome stage, second one is acute encephalitis, third stage is coma and death. Now, depending upon the symptoms observed in animals, this can be categorized as furious rabies, that is when the animal shows various furious expressions or is wild enough and is furious enough. It is in a rage. The second one is dumb, that is tranquilly, rage tranquilly. And the third one is legendary Guillain-Barré syndrome. Category 1, according to World Health Organization, in category 1, touching or feeding suspect animals but the skin is intact. In category 2, minor scratches without bleeding from contact or leaks on broken skin. And category 3, due to one or more bites or scratches, leaks on broken skin or other contact that breaks the skin or exposes the bats. Now, what are the clinical findings? That is, what are the different types, what all different types of symptoms can be observed in an individual? First one is bizarre behavior. Bizarre means unusual behavior, like a mad person. All of a sudden, the sane person, a normal person, would behave very differently. Bizarre behavior. Then the person remains agitated, means he is disturbed throughout. There are seizures, difficulty in drinking. The person faces difficulty in drinking. That is due to spasms and the muscles in the jaws, they contract. As a result, it is very difficult or painful for a person to swallow even water. And therefore, he avoids water. That is why it is also known as hydrophobia. The animal would run away from seeing the water. So, patients are also unable to take water or any solids. They are afraid of water, as I have told you. Even the sight or the sound of water disturbs the patient. As well as a result, the patient suffers with intense thirst. The spasms of pharynx produces choking, and the death follows within 1 to 6 days. There is a respiratory arrest, and that will ensue later on. In some cases, persons may survive. Headache, fever, or sore throat is observed. Nervousness and confusion arises. Pain or tingling at the site of bite. Then wherever the animal has bitten, either here or on the leg or on the trunk, wherever, there is a tingling pain at the site of the bitings. Hallucinations, that is imagining or seeing things that are not really there, which does not really exist, that is hallucinations. Hydrophobia, that is a fear of water due to spasms in the throat. And paralysis, it is due to, means why paralysis will ensue? Because it is basically a nervous system which is affected, and therefore unable to move the parts of the body, would lead to coma or death. The clinical manifestations, the first one is non-specific prodrome, then second followed by acute neurological encephalitis, that is profound dysfunctions of the brainstem. Third stage will be coma, and the fourth one will be the death. In rare cases, the person may recover from it. Now, in non-specific prodrome, it may last from 1 to 2 days to 1 week. This includes fever, headache, sore throat, anorexia, nausea, vomiting, agitation, depression, and parenthesis or fasciculations at and around the site of inoculation of the virus, that is at the site of biting. This is how it is a photograph of a person who is in a grave rabies conditions. Even the hands are tied with belts and other things. Majority of them will succumb to the disease. Now, clinical presentation, or what are the clues in diagnosis that may lead to the help in diagnosis. In most cases, human rabies is diagnosed primarily on the basis of clinical symptoms, as well as the signs which are expressed or shown by the individuals, as well as the corroborative history of or the evidence of animal bite. Even the dog or the animal who has bitten the person, if possible, the animal is captured and is kept for observation, and it is observed that whether the animal dies or not. So, death of an animal is also an evidence. Then, incomplete or no vaccination following exposures. The facility for laboratory diagnosis and confirmation of rabies is there, be it humans or animals, is available pre-mortem in only few institutes in India where it is diagnosed. Now, how laboratory diagnosis is done? First is clinical differentiation from other cases of encephalitis. Second is post-mortem diagnosis by demonstration of Negri bodies. This is a very important one. Negri bodies can be identified and it can be stained differentially by using negative staining procedures, and the presence of Negri body confirms the diagnosis of rabies. Then next it follows isolation of virus from mice brain by inoculating into mice brain. It can be tissue cultured on even cell lines, for example W138 and BHK cell lines. One of the possible emerging method is PCR based method, and if IF methods, if methods, that is IF methods for corneal impression method. Okay. So the common confirmatory test of rabies includes standard pre-mortem test, and this is a fluorescent antibody test which demonstrates the presence of the viral antigen. The standard post-mortem test is the biopsy of the patient's brain and examination for Negri bodies. Laboratory findings can be done after even CBC, that is complete blood checking, and CSF, cerebrospinal fluid testing, so as to exclude other etiological diseases. Then pathological findings includes the formation of cytoplasmic inclusion. Now what is that cytoplasmic inclusion? Negri bodies. Antigens can be detected by specific immunofluorescent techniques. Antemortem, conjunctival and skin biopsy from nape of the neck. Post-mortem impressions from the surfaces of the salivary glands, hippocampus, and histological examinations are also being done. ELISA test exists for the specific antibody detection, as well as I have told you, there is a PCR method. This is a cell which is showing the presence of these Negri bodies. So inclusion body, Negri bodies are basically inclusion bodies, and they are 100% diagnostic test for rabies infection, but it is only observed in 20% of the infected cases. This is a photograph of a Negri body in brain tissues. This is the one here. So Negri bodies are round or oval inclusion bodies that can be seen in cytoplasm and sometimes in the processes of neuron of rabid animals after death. Negri bodies are eosinophilic, sharply outlined, pathogomonic inclusion bodies, 2 to 10 micrometers in diameter, found in cytoplasm of certain nerve cells. PCR is one of the emerging methods for diagnosis. Differential diagnosis includes the differentiation from other viral encephalitis, hysteria reaction to animal bites, Guillain-Barré syndromes, differentiating from poliomyelitis or allergic encephalomyelitis. How this disease can be prevented? It can be prevented by pre-exposure prophylaxis and pro-exposure prophylaxis. One of the first vaccine to be developed for rabies was prepared by Pasteur by drying various pieces of spinal cord of rabies infected with the fixed virus. In 1885, Joseph Mister, whose photograph is shown here, he was a 9-year boy vaccinated by 13 injections which were given around in the trunk, where it directly very much near to the spinal cord, and the patient was saved. Now the pre-exposure vaccination is indicated in laboratory workers, veterinarians and technical staff who is or who may have the chances of exposure to such animals. For example, persons working with the forest departments, roaming in the forest departments, the veterinarian staff, the technical staff of the veterinary hospital, as well as bat handlers. They are the one who are the persons who should be given vaccination right from the beginning. That is pre-exposure, before the exposure of the virus to the person. That is pre-exposure vaccination. So such persons are given the vaccinations in the beginning, pre-exposure, before exposure. Then supporting care in animal dogs. Now the basic care in animal bites is before exposure to infections, pet or domestic animals have to be again given the same kind of vaccination. In veterinary surgeons or animal handlers, specific prophylaxis after the exposure to dog bite and after local treatment. Cauterization, scrub with soap and clean water, use citivation, tincture of iodine, anti-rabic serum, and do not suture the wound, that is, do not close the wound unless highly essential. If you are bitten or scratched, then tell and healthcare workers immediately. Wash the wound with soap and water. Inform the doctor right away. For example, this is the one which is shown here, scratches on the hands. Post-exposure prophylaxis means once the animal bites, then prophylactic measures which have to be taken immediately after biting the animals. First includes wound cleaning and treatment. Wash the area of the animal bite thoroughly. Thoroughly means very thoroughly, using soap and water, because the viruses are very sensitive to detergents. They are sensitive to iodine. They are sensitive to other substances like alcohol and ether. So wash them very thoroughly. So the load, that is the number of viruses, can be reduced. They can be removed. Initial treatment for an animal bite should include thorough cleansing. However, all animal bites should be seen by a physician. Do not avoid to go to physician thinking that we have thoroughly cleaned the wound and it will be sufficient or it will suffice enough. But you should do that first, followed by a visit paid to a physician. Apply pressure if the bite is actively bleeding so as to avoid the blood flow. Post-exposure vaccination. Basically, anti-rabies vaccines are given when a person is bitten, scratched or licked by rabid animal and the animal is kept under observation for at least 10 days. Now, as I have told you, different categories as recommended by World Health Organization includes category 1, which is during touching or feeding suspect animals but the skin is intact. Category 2 includes minor scratches without bleeding from contact or leaks on a broken skin. And the category 3 is the one or more bites or scratches, leaks on the broken skin or other contact that breaks the skin or exposure to bats. Vaccines are available in the market and they are very easily available. This vaccines contains 5% suspension of infected sheep brain, that is sheep brain which is infected with fixed virus. It is inactivated with phenol at 37 degrees centigrades and vaccines are available after inactivation with beta-propiolactone, which is commonly used in India. Vaccine contains nucleic acid capsid antigens and small quantities of glycoprotein G, which is used in developed countries with neural complications, under neural complications. Now, dose sample vaccines includes class 1 is 2 ml for 7 days, 5 ml for 14 days and 10 ml for 14 days. Class 3. This is the different classes as we have described earlier. And in BPL vaccines, it is 2 ml 7 days, 5 ml 10 days and 5 ml 10 days. Neural vaccines includes class 1 is at a slight risk, class 2 is at moderate risk and class 3 at a great risk. Neural vaccines may cause neuroparalytic complications and Laundries type ascending paralysis. The dose is regulated according to the grade or a class of bites, and in many countries it do not use in view of neurological complications. Then there is a vaccine which is human rabies cell culture vaccines. These are basically human diploid cell vaccines, HDCV. They are developed by Koprovsky, Victor and Plotkin. Here the purified chick embryo cell vaccines, that is a third one, is PCEC. We also have purified viro cells vaccines, purified duck embryo vaccines. So these are various types of vaccines which have been developed. One in human diploid vaccines, diploid cell vaccines, other one is in purified viro cell vaccines, and the third one is purified duck embryo vaccines. Now, the post-exposure prophylaxis vaccine is given for 6 to 7 days and the dose is given on 0 day, that is the day of biting, followed by 3rd, 7th, 14th, 30th and 90th day. Immunity would last for 5 years and this vaccine is given or injected on deltoid region. This is the one, and it is not to be given in luteal region. This is the photograph which shows the active immunization as it has been marked 0 day, 3 day, 7 day, 14 days and 28th day. At present, the cell culture vaccines which are commonly prescribed include human diploid cell vaccines, purified chick embryo cell vaccines and purified viro cell vaccines. Okay. Now, what we discussed just now was vaccination, and that was an active immunization, that is pre or post exposure. Now coming to passive immunization. Passive immunization, as we had discussed in detail in the past lectures, is basically the immunization by injecting a preformed antibodies which have been manufactured or which has been prepared in some other animals. Those antibodies, they are purified, and that antibodies, they are directly being injected in the infected individuals. So passive immunization is one of them is a human rabies immunoglobulin, HRIG. This is given to high risk bitten on face and neck when an animal bites the neck region or the head region or the face, because as it has been described earlier, the transmission of the disease is dependent upon the days of transmission, or the time for transmission depends upon the position of the biting. If it is bitten in the legs or in the arms, then it takes, virus will travel from this nervous system to the central nervous system at the back, and then from there it travels to the brain. But if the bite of an animal, infected animal, is on the neck or on the face, then you don't have much time left out for body to prepare the antibodies. So vaccination is not the preferred mode of prophylactic measure. In that case, passive immunization is the one which is preferred. So it is given to high risk individuals who are bitten on face and neck, and the dose which is given is around 20 IU international units per kg weight. Half at the site of bite, means where the virus has bitten, and the rest is given through intramuscular route. Active immunization should be initiated with passive immunization. So active immunization alone would not be enough, but a passive immunization should also be done along with the active immunization. Now, what is the future of rabies vaccine? Number of experimental vaccines are at present developmental stages, which may provide alternative, safe and potent but less expensive options. This includes specifically DNA vaccines, recombinant viral vaccines and recombinant protein vaccines. Further testing is needed to determine if and which one of these novel vaccines will make their way into mass production and application in the future. There is also a possibility of subunit or genetically engineered vaccines for rabies. Here, a viral immunizing agent that has been treated to remove the traces of viral nucleic acid so that only the protein subunit of the virus remains. That is, the genome has been removed and the genome is RNA genome. So, the only protein portion remains, and that is what the antigenicity is. So, these subunits have less risk of causing adverse reactions. Several trials are underway. Now, the epidemiology. No danger of nursing rabies patients but they have to take precautions. There is not much danger of a nursing staff, but they should always take precautions. Any animal bite can cause rabies except mice. Bats in caves. Remember, bats are the flying mammals. They are not birds, they are mammals. So they are prone, all mammals are prone to rabies infections. So bats in cave, they spread the disease by respiratory route. In India, approximately 30,000 people die with rabies every year. The rate is slowly and slowly dropping down due to the vaccination as well as the urbanization programs. In spite of health education, several individuals they die due to rabid infection in the developing world. This is the typical diagram where a person is being attacked by dogs. This is a rabid dog, ferocious dog, which is shown here. On every year on September 28th, World Rabies Day is celebrated, and it is a day where a cooperative global events are planned to reduce the suffering from rabies. This day celebrates Dr. Louis Pasteur's vision of rabies-free world. So, at the end, the word of caution is never touch an unfamiliar or wild animal. Always ask permission to touch someone else's pet. So thank you very much. This PowerPoint presentation was brought with the help of Dr. T.V. Rao, who prepared these slides. Thank you very much.